Today we will learn about cardiomyopathies. There are different types of cardiomyopathies like hypertrophic cardiomyopathy, dilated cardiomyopathy, arrhythmogenic cardiomyopathy. So we will start with hypercardiomyopathy. So hypercardiomyopathy is increased left ventricular wall thickness, of heart, and often involves interventricular septum. Okay, and at microscopic level, the hypertrophic cardiomyopathy show myocyte hypertrophy and disarrangement with the fibrosis. And genetically, hypertrophic cardiomyopathy include sarcomeric mutations. Okay, and in 30 to 50% of patients, and increasingly to 70 to 80% when two or more family members are affected. Functionally, hypercardiomyopathy involve mitral valve abnormalities, positive negative left ventricular outflow tract obstruction, diastolic dysfunction. There is a dysfunction in the diastole, and atrial fibrillation. Now we will see about dilated cardiomyopathy. Dilated cardiomyopathy includes dilated and thin-walled left ventricle, increased heart mass, and diffused interstitial and replacement fibrosis with degenerative changes and mutation in over 50 genes in familial forms. A genetic basis is seen up to 40%. Laminal mutations account for 5 to 10%. And left ventricular or biventricular systolic dysfunction, early phase of isolated left ventricular dilation, can be seen in relatives. Now the last type is arrhythmiogenic cardiomyopathy. This is right and left ventricular wall thinning, fibrous replacement, fatty infiltration of outer wall, myocyte degeneration with fibrofatty infiltration outer wall, desmosomal mutation in approximately 40 to 50% of individuals. Right ventricular or biventricular systolic dysfunction in the systolic function, and ventricular arrhythmia are common, can occur in the absence of overstructural abnormalities.